on the model.
Can you name one other hospital that provides paediatric ECMO without a cardiac surgical program, including bypass?
No, that level of understanding, no, I can't. I'll have to take that on notice.
I look forward to you taking on notice. I can answer the question for you. There are none in Australia or New Zealand.
Okay. Well, I'm confident that
the chair's a doctor.
I'm confident.
What do we do? I mean, it's a new world, Minister.
I'm confident, Dr. Cohn, that I'm confident that we can do it because we are doing it. That's what I'd say. We are continuing to deliver what I think is world-class healthcare at those two children's hospitals.
So in your letter to the Medical Staff Council, you cited that paediatric cardiac surgery is a team game, and as you've mentioned, the broad range of clinicians that are involved in addition to the surgeon, which I really appreciate as well. But is that not also true for the provision of ECMO? How can you be confident in the quality of emergency ECMO when that whole team doesn't have the volume of practice that they would if they also were performing medium complexity cardiac surgery with bypass?
Well, because I'm confident that given trauma and ECMO services are now being delivered and continue to be delivered at both sites, and that's been the case for a long time. I'm confident, and more importantly, I want the community to be confident that if their child needed that level of care, they would, through one of those two hospitals, get in what my, probably bias, I understand that, opinion is, some of the best levels of healthcare for paediatrics in the world. And I'm confident that the system has been up and running robustly at the moment, continues to do so. But is it an area that we monitor? Absolutely we do. Of course we do. I think the committee would expect that of me as the Minister and that of my officials, and I'd certainly expect it of myself. But that's the decision that we've made, and we believe that's the best level of care that we can provide some of our sickest children at the moment, and we'll continue to do that.
I understand that surgeons at the Children's Hospital in Westmead have tried to plan cardiac surgery for older children at Westmead Private Hospital rather than at Sydney Kids Hospital in Randwick. And that report was in keeping with widely publicised reports of unacceptably long waitlists for elective surgery at Westmead due to short staffing. Why do you continue to stop medium complexity cardiac surgery from taking place at the Kids in Randwick when the necessary expertise and equipment is already in place?
Well, because as I've said, there's no change from our perspective in the current arrangements for cardiac surgery at the network. Low complexity cardiac surgery is provided at both hospitals, as I've said. Trauma and ECMO, as we call it, will continue to be provided at both sites. We're talking about small numbers of highly complex procedures that we believe is important to be done at a site where that volume is sufficiently high enough that the expertise and skills of clinicians can continue to be developed. Ms Wilcox, did you want to add anything in terms of anything that I haven't added that for the Chair?
Yeah, I think just to add in relation to the ECMO, and again, I'm obviously not a clinician in this area, but certainly the advice from the clinical team and the team at the network is that ECMO can be implemented by people other than cardiothoracic surgeons, and there are a number of large hospitals around the world, particularly in Europe, who are now conducting this, not just in cardiac.
Yeah. So I'd note that medical specialist training varies greatly across the world. We generally recognise, for example, New Zealand training.
Yeah.
I repeat my question, which has already been taken on notice. Is there a single other hospital in Australia and New Zealand that's providing ECMO without a cardiac surgeon?
I'd have to take that on notice, not to my knowledge.
And my last question was just about volume. Minister, in your last answer, you talked about high complexity procedures, and I'm not aware of anyone disputing that the very high complexity procedures should be centralised at one site. So I'm really focusing on medium complexity procedures that need bypass here. Is there any evidence that mortality or morbidity has improved since those procedures were centralised at Westmead?
Well, I don't know if there's any evidence. I haven't. I'll take that on notice, only because I don't want to mislead or give you the incorrect information. But just to say to the committee and to the community that the delivery of first world-class healthcare at those two hospitals is pretty important to me. I know it was important to the last government, and we'll continue to make sure that the model we have in place treats the sickest kids in the very best way possible. And I think that's what you would expect. I'd expect that of myself. It was my child, and we believe we've got that model. But Dr. Cohn, I want to be clear about this. I understand that there are sometimes challenges and clinical disagreements and debates. I for one, think that makes us a stronger and healthier public health system, not one that I want to discourage. That's all.
Thank you, and I look forward to your answers to those questions on notice.